Hi, everybody. Welcome to this exciting podcast on mental health and clinical psychology. So we are fortunate to have with us Dr. Sugnyani. She's a
Hello.
seasoned doctor and mental health professional, and she's gonna today we're gonna talk about early intervention in child development, and basically we're talking about autism and mental disorders in children. A very sought after topic, something which has we have been requested a lot requested. So welcome, Dr. Sunyani. It's a pleasure to have you. How are you doing today?
Thank you. Thank you, Chetan. I'm fine. How are you doing?
I'm good. So, why don't we start with a quick introduction about yourself? You've had a great journey. Why don't you talk to the audience about you, your journey, what you've been doing, and what your approach to diagnosis?
Yeah. I'm Dr. Sugnyani. I'm a child and adolescent psychiatrist. I'm practicing since last 15 years in child mental health. My areas of interest are developmental disorders like autism, learning disorders, and attention deficit hyperactive disorders, and development intellectual disability. And I believe in early intervention and the wellness of the child over a journey of their life.
Yeah, I think that's a very, very important topic, and I think that that's something which a lot of parents and a lot of uh, people would really love to hear about, and it's something which is very misunderstood. So, let's start with what exactly you mentioned early intervention, right? What exactly is early intervention in child development, and why is it so powerful?
Yeah, yeah. Early intervention is detecting as early as possible any disorders and delays in children. It from birth to 6 years usually, so that we can early identify and intervene early, so that their journey will be smooth later on. Okay, and it involves a structured assessment and planning individualized interventions and involving the parents and tracking the progress over a period. Okay, and why we it is so powerful means during the like at birth, if you take around 25% of the brain is like a birth brain is like adult, and as we grow by 5 years, the it is 90% grown, like 90% of the adult brain. That's why during this period, this window period, there is a lot of fast growth of neurons and synapses, and there will be, and the brain is moldable and adaptable. Like whatever we teach, the brain is able to take it. Okay, that's why we'll call it like if you train the child early, then the prognosis outcome will be better because of the fast growth of neurons, and they are able to learn by the experiences and neuroplasticity of the brain.
That's uh, that's pretty an eye opener. So generally, they say that in the development of a child, the first few years, like the first 5 years,
Yeah,
are very critical. They're considered a critical window for brain development. Now, why is it so?
yeah.
And beyond that, is it not? I mean, after that, is it too late, or so just explain a little bit about the early years of child brain
Yeah.
development.
In earlier, as I told, that there is a lot of neuroplasticity, development of the synapses. If the child is exposed to the different environment experiences, like child is stimulated in all the areas. We give the importance of sensory motor stimulation. If the child is stimulated, like all the senses, like hearing, vision, touch, smell, and tactile, everything, then the neuronal growth will be more. Okay, and the synapses will be strong, and that circuits will develop later. For example, if you take the child is not exposed to any communication and hearing, okay, only exposed to the screen and not given opportunity to socialize with the kids, then that circuits of socialization and the communication is not developed well. Okay, that's why these periods are very important, uh, so that we can stimulate the child maximum and help the child to develop the circuits.
So, from a parent's perspective, I think what are the earliest warning signs that parents sometimes miss? Because, like you mentioned again, how important early stage development of the brain of a child is. So any hints or signs that a parent may miss in that during that period?
Yeah, like we have to look into the overall development of the child. Like there are four milestones, developmental milestones, as we tell, like motor milestones, like how the child is having neck holding, sitting, walking, running. Okay, if it is not happening according to the age, like usually like neck holding by 3 to 5 years, okay, by walking 1 year to 1.5 years. Same in other areas also, speech and language. If the child is not able to babble by at least 1 year, and child is not able to speak 1 or 2 words by 2 years, and the child is not able to speak by 3 years, then definitely some concerns in a speech and language. If the child is not able to have like social delay, not able to make eye contact, not able to point by 1 year, not able to respond to the name call by 1 year, okay, and child is not able to play imitation games by 3 to 5 years, and not able to connect socially emotionally, then the child has a deficits in social development. If there is a like cognitive development also, if the child is not able to learn according to the age, like how the colors and shapes are learned by 4 to 5 years, and the alphabets are learned by 6 years, okay, and the self-help is everything is learned by 4 to 5 years, 6 years, then if it is not going according to in all these milestones, then there is a concern. Okay, if it is like 3 to 4 months delay compared to the normal range of the child, then definitely there is a concern, and these are the red flags.
So, we have this concept of a late bloomer, right? So, sometimes where do you distinguish between uh, somebody who a child who's having a real development concern versus the general tendency to okay he may be a late bloomer, it happens. So,
Yeah, yeah.
what is the thin line dividing the two?
Yeah, yeah. That's why this developmental screening plays a very important role here. Like clinically, if you see, if the child is having milder delay, not so severe, and it is only a few areas are delayed compared to all the milestones, and the child is able to grow steadily over a period and learn, and there is no definite deficits in any areas of functioning, then we can think some delays are there. Okay, but if it is more than 3 months delay, and it's very severe, and the child is not able to function in day-to-day life, and it's all the areas like motor, speech, cognition, and socials, everything is globally affected, and there is a deficit in adaptive skills also, then definitely there is a concern. Okay, because many parents thinks will wait and watch, and my she's a very shy, that's why she's not speaking, and the boys will speak late, and his parents also spoke late, that's why he's lagging, and we have exposed him to the screen and not given opportunity. Okay, that's why the child is having delay. But few months delay and few areas delay and mild delay is okay, but if it is goes beyond that, it's a definitely a concern.
Okay. Wow, that's such an eye opener. I mean, it's so easy to normalize, especially in our culture. We tend to
Yeah,
kind of
yeah.
think it's very normal. I mean, it's something which you shouldn't be worried about. But sometimes, you have to be a little cautious about it. And I think you really said some very important points there. Now, again, as you mentioned about coming back to early intervention, how does it help children, who are differently abled? Uh, with
With the special
autism,
needs.
with autism and other disorders, how does it help diagnose that? Yeah.
Yeah, like if we don't address the child need early, then they face difficulties in later in their life. If the child has a speech delay, if it is not addressed, where the speech circuits are developed between 2 to 3 years, okay, if it is not addressed, when they start going to this preschool, they have a difficulty communicating with the teachers, socializing with the friends, or not understanding the instructions, not able to learn according to their age. Okay, then they face a very difficulty in like social life, academic life, and their self-esteem will also come down, and they are very prone for bullying. Okay. That's why it's very important to intervene them before they enter into preschool. Like we have to make them ready to enter into the school to prevent the long term disabilities, long-term difficulties, early intervention is very, very important.
Okay. I think you kind of covered that in your early answers, but coming back to it again, what are the telltale early signs of intellectual development disorder that parents should watch out for?
Yeah, yeah. Like as early as, like, if you take 1 to 2 years, the child is not responding to the parents, okay, and very slow in exploring the environment, not able to understand the simple commands like come here, give that, okay, and not able to speak according to the context, and not having a vocabulary according to the age. And as they grow, they are not able to even perform their daily living skills, not able to understand the academical skills, and not able to understand the other social things also, like able to take a decision, solve the problem, okay, and face the difficulties, challenges in a day-to-day life, okay, like they have a difficulty in understand the concept of safety, okay, those things. As they are growing, they have a difficulty in adaptive skills and difficulty in day-to-day life. And delay, some kids, they have delays also, like as we spoke about, like milestones. All the kids with a developmental disorder, like intellectual developmental disability, will not have any delay. Some kids, they may not have delay, but their intellectual quotient will be less than 70 if you assess clinically, and they have a difficulty in their adaptive functioning, like decision making, understanding the concept, analyzing, okay, those areas they have a difficulties.
Uh, and when do specific learning disorders become visible? And can we act before school failure happens? Generally, they say that once you go to school, it's probably a little too, not late, but you know, it could have been done a little earlier. So is this myth true, or there's some truth to it?
Yeah, like we can understand when they start going to the school, because we are giving the opportunity then only for the reading, writing, and maths and spelling. Before that, they have subtle symptoms also, like difficulty understanding the right and left, confusion, difficulty understanding the time, difficulty in the fine motor, like grip holding, okay, and difficulty in differentiating between two objects, matching, okay, like we'll call visual discrimination. They are not able to visually discriminate between A and C, those kind of things. They are not able to differentiate the phonics also, like they may not be able to differentiate between P, B, okay, they have a difficulties. Before 7 years, they have difficulty in auditory memory, visual memory, auditory differentiation, visual differentiation, and a little bit of difficulty in spatial organization. That happens in preschooler, but when you expose them to the schooling, real schooling of learning, that time we'll be able to find out. But like between 6 years to 8 years, they have difficulty in reading, difficulty writing, and like reversal of the letters, and not able to understand the whatever they read, and difficulty in spelling, and even understanding the maths concept also. Okay, in a preschool, there will be a little easy the syllabus. As it is getting harder, they find very difficult. As the syllabus is increasing, they may not be able to cope up with that.
That's
And definitely we can do early intervention in them, the remedial training and all, so that they should not have difficulty later in their classes.
that's
We have many tools to differentiate, like screening tools are there, like which can be done below 7 years also and after 7 years also. Okay, but subtle symptoms, the teacher, parents has to understand, and they have to seek, because they have even speech delay also, and limited vocabulary.
coming back to parents again, the role of parents here. So, in young children with, say, ADHD traits, for example, what should families, parents, and extended families do before considering medication?
Yeah, like many of them, they have a misconception that ADHD is just a discipline problem. Is ADHD kids that just that they are lazy? Okay, it's not like that. Like they have real difficulties in their concentration, real difficulty sitting in for a long period in one place, real difficulty controlling their impulses, delaying their gratification, we need to first understand their difficulties as a parents. Like if you take there is a definite treatment for ADHD, but we'll prefer if the child is below 6 years, the first line will be behavioral therapy. We'll tell parents to do some structural and environmental changes at home, some behavioral changes at the home, and some changes in the preschools, the classroom accommodations, and some changes in the child also, like teaching them the sitting tolerance, enhancing their attention. The behavioral therapy is evidence based before 6 years. Okay, if it is not working after the trial of behavioral therapies also, if the symptoms are very severe and it is affecting the child academic, and if there is a concern of safety to them, to the child and the other people, okay, and it is very much disturbing to the parents also, then we can consider in preschoolers also but medications, but it will be like lower doses, and we'll think about smaller doses, and we have to weigh the risk and benefits in that case.
Now, let's kind of take a step back to the actual process, right? We spoke a lot about what to watch out for and what are the symptoms and what parents can do. But now, what does a typical early intervention plan look like? Like, take it down to the nitty-gritties of it and who is involved in it. So, just for our audience, what exactly happens?
Yeah. Like if there is any doubt in their development or their concern regarding the child, then they have to consult a specialist, and the specialist has to do, like child psychiatrist or developmental pediatrician, neurologist, or a psychologist. Then we'll be doing a developmental screening. The first is to see whether there is any delay, okay, and then to notice after assessment what are the child's strengths and needs, okay, making a it will help in making a individualized intervention plan. And then in this plan, because this is a structured and individualized intervention and the parents are involved in that, it's not only just the therapist, it's not just a therapy session. The parents has to take an active part, will involve the parents also, because the therapy will happen only 2 to 3 hours in a session in the clinical setup. If the child is living in a natural setup, the parents are the definite people to help the child. That's why we involve the parents also, and over a period we will build a goals. Those are the measurable goals the child needs, and then we'll do a therapy involving occupational therapist, speech therapist, behavioral therapist, okay, if needed other physiotherapist, and then we track a progress over a period. Like if the goals is like the child is not able to even speak one word, okay, and then we plan activities and will involve the parents also. We do at home also, we do at a center based also, and we'll track the progress whether the child is able to achieve this goal by the end of 3 to 6 months, okay. If that is done, then we'll look into the higher needs, okay. This is a teamwork, and this is very structured, and it is tailor made to each child depending on their disorder.
So, generally, there's a tendency, especially in our culture, that we kind of there's a stigma attached. So, why do professionals, or why do families rather, delay seeking help even if they see telltale, noticeable signs of problem that they encounter? Why do they delay? And how important is parent training compared to these professional therapy sessions?
Yeah. Because the parents are the one who are seeing the child from the beginning and who spend a lot of time with the child. Okay, most of the time, if they notice the delay, but they will be in a dilemma or doubt whether it's normal, or sometimes they just compare with their own siblings and they don't take the norms. And one is the lack of awareness about the milestones. They don't know like how to track it. And other thing is sometimes it's a protective mechanism for them. It's a denial. Okay, why me? Why my child? Okay, he may grow well. Okay, it might be just time will heal everything. Okay, because of the denial and because of their protective. It's not like their carelessness or negligency. Sometimes they also be in a denial phase. Okay, and sometimes the reassurance with the family members, because Indian setup there is a multiple parenting, grandparents are there. They will tell that in our age we were also like this, and we didn't know how to learn how to read also this age. Okay, there will be reassurance by the grandparents, like his father also spoke late, will wait and watch. Okay, because of that also they may not consult early. Okay, or because of this stigma that has to be overcome by not only just awareness and orientation program, it should be done at every level. Like it should be like how the teacher conveys the parents, how the professional conveys the parents. Okay, now not just labeling the child, that understanding the child needs and helping the child as early as possible. Okay, because most of them they are like terrified by the diagnosis of like autism or other developmental disorders. Okay, instead of like labeling the child, telling them this is a this, and instead of that we can tell that these are the developmental delay which are happening, and then we need to work with the child so that he should not have any long term deficits.
Okay. I think you hit the nail on the head, Doctor. I think support, ecosystem support plays such a vital role in such cases. And we spoke about parents and we spoke about families, but I think another very important stakeholder in a child's early development are teachers, right?
Yeah, yeah.
So what role do teachers play in early identification and support? And do you think that teachers are aware or sufficiently trained to identify, or do they actually uh, take it seriously, or it's because teachers is just a role, right? I mean, they're doing a job in the end. So what are your thoughts on that?
Yeah, then nowadays lot of teachers are trained in the child psychology, and they know it. They may not be able to diagnose it. They may be able to know like some, because they will be comparing with the 30 to 40 kids. They know each child. They know if some delay is there in one child, they will be able to identify it because they spend a lot of time with them, and they can compare with the other kids also, and they can track the progress over a period, because at the beginning of the admission how was the child, over a period end of the year how is the child. Okay, they are the better people to identify any delays or any learning delay, social delay. The child is not able to play with other kids, the child is not able to understand the commands, the child is not able to learn better like compared to other kids, the child is not socializing. Okay, they are the better people to recognize early. And the conveying part, how they convey it, it depends on them, how the parents receive. Okay, if they convey it as a concern, like your child is not able to mingle with other kids and we are concerned about him, and how we can as a teacher, as a parent, as a professional, how we can help him so that he can be like other kids, then it matters a lot, rather than just labeling the child or criticizing the child. Okay, and blaming the parents.
I think it would be very interesting to see because you have a lot of experience and you've must have seen numerous cases. Could you actually, jog your memory and list some very interesting and uplifting cases, a couple of them, one or two cases that you could talk about for our audience, which really, which stood out for you?
Mm-hmm. Yeah, actually, to speak, a lot of mental health professionals or a lot of other professionals from a medical background, okay, they will be able to identify it, but some of them they undertreat it, overdiagnose and undertreat. I had a couple of here professionals kids, okay, and they were diagnosed early because of the awareness and all, but when they had a concern, we need to like educate them, we need to tell them this is a real concern and we need to do the screening, and then we need to plan the individualized education for the child, and then initially there will be a difficulties to make them understand the child is really going through some delays. Okay, they will think like we'll wait and watch.
What was the behavioral traits? What was the challenges you saw in that kid?
Yeah, child having minimal eye contact, minimal socialization, not speaking according to the situation, not communicating the parents, basically the child had autism, and the parents were in a denial phase, but still we could do some screening test, developmental test, and to make them understand these are the areas which the child has a difficulties, and then understand educating them, and then planning the intervention over a period over 3 to 6 months. The child started making eye contact, started communicating his needs, they started speaking in a single words. Okay, then it was a like great pleasure in them, great happiness. Yeah, we have intervened the child early, and we are seeing progress, because in all this developmental disorder there will be micro gains. It will not happen in a day. If the child, the therapy today we have start means the child will not learn the skill in a day. It takes a time. They have to do at a center also. They have to generalize in a natural setups, like in a when at home. That's why the parent training becomes a very important role. When the parents and the therapist both work together, then the really will see a definite changes. When the child comes and responds to his name and greets you, then you really feel very very happy seeing the child.
I think that's probably the biggest success you could have, right? Just on that, is it happened that sometimes you couldn't help a child? And of course, we have a tremendous track record and experience of doing, but it might happen that due to whatever factor sometimes, is there any case where we tried our best, but it couldn't work because whatever reasons, due to support from parents? So in that case, how do you handle it?
Yeah, yeah. If there is a like serious, like the severity of the illness is more, if it is more like severe autism, severe intellectual disability, severe ADHD, it's a really challenge for even the parents and the therapist and the professionals also. And if there are no motivation from the parents, and lack of awareness in the parents, and difficulty concerns, like right now we have a difficulty getting resources, because it has to be done on daily basis, 1 to 2 hours per day, and it has to be taken to the home also. At least they have to do at home in a daily setup, like during play, during bathing, during their day-to-day activities. Okay, both parents if working, and there is no family support, no social system support, okay, then the child will be lost. The child will not be like getting real help. I had a one parent, but both parents were working, and one parent had a mental illness, and the child had a severe autism, and it was not early diagnosed. It was diagnosed later, around 5 years, and they have not intervened until that. Okay, and the awareness was also less. After the evaluation and after the diagnosis and after the like educating them, they tried it, but there was a minimum improvement, because if you do it before 3 years, then less extensive therapy and few therapy sessions are required, and the child will learn quickly. If you diagnose later, like around 5 years, more than 5 years, okay, and then if you do also, some little bit improvement will be there, but not like early.
Generally, how much time does it take for diagnosis to treatment? I know it varies case by case, but average, how much time
Yeah,
does it take?
yeah. In our center, as soon as a child comes, we'll take a history, clinical observation, and we'll educate the parents that these are the delays or the needs of the child, and the child needs a detailed evaluation. Then we'll call them for a detailed evaluation. Detailed evaluation will take 3 to 4 hours, and depending on the child age and the needs. Okay, if you are doing 3 to 4 assessment, okay, then it has to be done detail, and then we'll plan the individualized education program and intervention, and we'll talk with the parents regarding this, like these are the needs of the child, and we need to help over a period, and then we'll take them for a therapy. It is done like daily basis. If they have like speech therapy, behavioral therapy, other things, it may be like 2 to 3 hours, or otherwise it is a 45-minute session, one-to-one session. During that time, we like before the session also we can train the parents regarding the behavioral principles of learning. Okay, how they have to do the manage the behavioral problems. Okay, basically in behavioral therapy, we increases the child's strengths and we decreases the child behavioral problems using the behavioral principles like rewarding and again giving individualized attention and more of those things we'll use and like teaching them step by step using more of modeling techniques, helping techniques, rewarding techniques. And we'll train the parents also. We'll tell them that only the center based is not sufficient, you have to do at home also in a natural setup at least 3 to 4 hours per day. Then only there will be definite changes in the child. It takes a period like from assessment to the therapy, it may be like 1 week, and then taking a therapy and setting a plan. Initial 3 months uh, very intensive training. Okay, later on we'll decrease the sessions depending on the child needs.
I think you've touched on pretty much everything that we need to know about it. One last question before we close, Dr. Sugnyani. I think, see, the environment at home probably makes the biggest difference. Yes, you have the best
Yes, yes,
medicine,
yes,
the best
yes.
treatment. Now, what are some small daily habits, or what kind of environment parents or families should ensure that they have at home, which creates the biggest impact for kids who are suffering from such conditions?
Yeah, yeah, yeah. Because first 2 years of the life are very important. The parent has to connect with the child. They have to connect emotionally, and they have to connect because they have to be there with for the child. They have to play with the child. They have to talk more with the child, and because as much as they narrate and talk, the child will be able to understand better. And they have not only just most of the parents, they think like taking care of the child is just feeding them, sleep, making them sleep and taking their personal hygiene. Okay, it is not sufficient for their bigger experiences. Okay, we need to, every parent has to play with the child. The play will help in many areas. Okay, expression and communication and bonding, everything happens through the play. Daily the parents has to play at least half an hour with the child, and they have to talk more. Okay, and they should reduce the screen time, because the screen time will decrease concentration, increases social and speech delay. Okay, the screen time should be zero before below 2 years of age. Okay, and they should read at least one story per day. That will improve their vocabulary, imagination, speech and language, everything daily. As soon as the child's birth happens, there are many books which can be read for the infants, for the 1 year toddlers and all. Okay, lot of books are there. Daily, my suggestion for the parents is to read one book for them. Later on, they start reading by themselves. Okay.
Well, that's wonderful thoughts. I think it comes down to some habits that we've forgotten, I guess, over the last, as we have evolved. These are very simple things that somehow we've forgotten, but I think you raised very, very important points. I think thank you very much, Dr. Sugnyani. I think this was such a eye-opening discussion on autism, learning disorders, early child development, early intervention, all the topics we covered. I think this will definitely resonate with with parents and families who feel and they need that help. So thank you very much again, and hopefully we'll have more such sessions. And thank you for joining us again.
Thank you. Thank you.